that we hear from our police, and they are the frontline people in our county. 70 towns we have, and we have so many people that really can connect better with the awareness needed, that our police are available for us, and they are creating all sorts of programs and ways that they can just be there more for our community. And it's so important that all of us, as we navigate the opioid epidemic especially, know more. Knowledge is power. And the one thing I know as a woman in recovery is that as a woman in recovery, and I have been in recovery for 33 years. Now, that doesn't mean I want to have a drink or a drug. It's not even in my mindset, but it does mean that part of my living in recovery is to be of service to others and to help others that need help, and that I talk with others on a regular basis in the solution of problems. And it's a wonderful thing, and I think our world can recover as well in certain ways just by having more dialogues, more conversations about addiction, addiction awareness, which is a disease process, and mental health issues, which go hand in hand. Hello, Prosecutor Musella. How are you tonight?
Good to see you again, Nancy. Good. I'm great. Thank you.
I have to tell you one wonderful thing about Prosecutor Musella. The other day, we had a Black Balloon Day event at Bergen Newbridge, and it was quite a success. Many people were there, and what I wanted to really just mention right now is that I was really touched by the fact that you and your wife both were there the entire time, Prosecutor Musella, listening to the speakers. That was fabulous. Thank you so much for just being there. And thank you.
Well, thank you for being part of that event. It was a pleasure to be there, Nancy. And like I said before, you really inspired me and members of my office. And, my wife and I really are, we went to the Black Poster Project and we went to the Black Balloon Project, and we're really struck by just the loss of life of the young people in this county. And, I'm just really proud of the work we do here in the prosecutor's office. And again, you're just really an inspiration to us and all our partners. So it's the least I can do to come to these events and be there and listen to what the young people have to say, people that are struggling with substance abuse disorder and addiction, and to hear the stories and just be part of, just to be part of it and to help support everyone that's in recovery. So again, and I want to thank you for the work you're doing. I want to thank Morgan for the work she's doing, and all our partners, which I'll mention at the end. You guys are really doing great work. And this event, something like this, where you honor police officers, it's really appreciated. And I think you hit it really on the head on the nail with this one, Nancy. So that's why I'm honored and proud to be on this event every month. And just keep up the good work. And again, I enjoy working with you and partnering with you. And thank you for all you do. And I do want to just mention, I don't know if I said it at the last, but Nancy was the winner of our Meritorious Service Award for 21 for our community partner. And that's because of the bridges she's building between people in recovery and the recovery space and police officers and the work that we do. So, it's a partnership. We can't do it one hand without the other hand. So thank you for everything, Nancy. And again, it's my pleasure to just be part of this. So, I just want to kick this off as I do every month by just giving you some numbers and telling you about some of the things we're doing here in Bergen County with our partners to help fight the opioid crisis. And it's a pleasure to be here because, we get to honor and thank the police officers, the men and women in our county that are really making a difference day in and day out fighting this crisis. And I do believe that, the work that we're doing, the prosecutor's office and with Nancy and our partners and just the work that all the police officers, the 3,000 police officers are doing in Bergen County every day is saving lives. So keep up the good work and thank you for your service. and thank you for your efforts, and thank you for your sacrifice. So Nancy mentioned and alluded to this, last year in the United States, overdoses, drug overdoses killed more individuals than car accidents, gun violence, or the flu combined. So if you think about that, for the first time ever, the CDC announced that 100,000 people died of a drug overdose in 2021 in the United States. And that's just really, that's staggering numbers, but those numbers, each one of those numbers is a person. And when you go to the Black Balloon Project, or you go to the Black Poster Project, you see all these young people, most of them between the ages of 18 and 30. And it's, it seems that those posters go on forever. And every single one of them is just a young life lost to this disease and this epidemic. And it's really just heartbreaking. So I want you to just think about that. 100,000 people died last year of an overdose in the United States. Importantly, however, there were 4 states where this number did not increase. And I'm happy to say that New Jersey is one of them. And I do believe that it is a result of the forward thinking of our partners and our initiatives and the law enforcement community throughout New Jersey, and especially here in Bergen County. So I do want to talk about, as I do every month, the 3 things that we are doing here in Bergen County, which I think is making a difference. And that is, number 1, prevention, number 2, connection, and number 3, diversion. Regarding prevention, as you may know, detectives in Bergen County are busy every day. In our Bergen County Narcotics Task Force, we're intercepting drugs every day in our interdiction unit along the near the George Washington Bridge and Route 80 and all the major highways that run and crisscross Bergen County. And at the same time, detectives in my office are in classrooms every Friday morning. We're in the 7th and 9th grade, presenting our Pathway to Addiction presentations. And we've been doing that for nearly the last 6 years. And this presentation really talks about the 2 ways in which young people get addicted to opioids. And we have seen that it usually starts with, and by talking to people in recovery, we see that it starts with either a prescription to an opioid as a result of a sports injury or some type of minor medical procedure like a wisdom tooth removal. Or we also see the other pathway is experimentation with substance abuse, with substances and abuse of substances like alcohol, marijuana, and pills. And so these are the 2 main ways that our young people get addicted to opioids. So we're in schools every Friday trying to talk to them about the dangers of these pathways. We also partner with the Bergen County Utilities Authority for their quarterly recycling events. We have been very active in a campaign to encourage Bergen County residents to clean out their medicine cabinets of unused and expired medications. We find that young people raid, for a better word, the medicine cabinets of friends and family and take these unused opioids and use them. And then again, it's a pathway to addiction. So we really need to be mindful of the dangerous drugs in our medicine cabinets, and we need to discard them periodically. And I really can't stress enough how important that is. Second tonight, I want to talk about connection, and that's the role that you police officers in Bergen County play. You play an important role in connecting individuals struggling with addiction to recovery every day. Since 2014, all police officers in Bergen County have carried Narcan. And as Nancy alluded to, last year alone, police officers deployed Narcan 362 times. That's almost once a day. Narcan was deployed by a police officer in Bergen County. There were 700 overdose deaths, almost 700 overdose strikeout overdoses in Bergen County last year. 136 of them were fatal. So again, that was 136 young people and people that we lost to opioid as a result of an overdose fatality. There were 10 less from 2020, but again, 136 is too many. So again, we don't track these numbers. I'm proud to say that officers connect people to peer recovery specialists. For the last 4 years after a Narcan deployment, officers call a recovery specialist to come to the hospital where the person has been taken. And these phone calls are just one of the many ways that Bergen County police officers are creating opportunities for treatment and recovery. A recovery specialist will come to the hospital and talk to this person about getting into recovery. Police officers also offer anyone arrested for a small, for possession or other low-level drug offenses or other low-level offenses that are drug-related, shopliftings, vagrancy, stuff like that, to an opportunity to speak to a peer recovery specialist. And of course, one of the main ways of connection to recovery in Bergen County is the Operation Helping Hand that we run through the prosecutor's office with the help of our partners and with the help of local police officers. During Operation Helping Hand, as you may know, peer recovery specialists sit in our headquarters in Paramus, and they meet with those individuals that are arrested, and they talk to them about treatment, and they are very successful in talking them into a recovery. So, to sum up in short, we are doing everything we can every time there is a law enforcement interaction with an individual and we use it as an opportunity to connect them to recovery. Third, I want to talk to you about diversion. So, as I mentioned, again, monthly, we started a diversion or recovery court program in Fair Lawn, and that project was really starting to take off, and it allowed individuals that were suffering with substance abuse disorder to work with a peer recovery specialist or peer navigator, patient navigator in court. We had those people there on the third Thursday in Fair Lawn, and we would have a special calendar where we would have those individuals struggling with substance abuse or with charges of low-level drug offenses or, again, shoplifting, something of that nature. We would have them meet with the peer recovery specialists and patient navigators right there in court, and the program was working. However, COVID hit, and it did interrupt that program, but we were very encouraged with the model, so much so that we are in the plans. We're planning right now to take that model countywide, and we're in the process and very close to starting a recovery court that will be a county recovery court, sort of like a municipal drug court. So we're very excited about that. So those are our three main ways that we are, what we're doing here in Bergen County, the ways that we're battling this epidemic. I do believe it's working, but there is a lot of work to be done. So I want to thank all our numerous partners that we work with every day. And again, we work with the County Office of Alcohol and Drug Dependency. We work with the Center for Alcohol and Drug Resources. We work with Bergen Newbridge Medical Center, the Black Poster Project, and D. Gillen, Alumni in Recovery, of course, Nancy. We also work with New Jersey Recovery Advocates, Lisa Gladwell, who was also there on Sunday. And, I've gotten to know these individuals, Nancy and Dee and Lisa, and I really, like I say, I'm just inspired by the work they do, and I can't thank you enough for your work you do. And I'm really honored and privileged, Nancy, and blessed to be working with you. And again, the 3,000 law enforcement officers in Bergen County, I thank you for your service. And again, I'm just blown away and blessed to be able to work with you every day in this fight. So keep up the good work. And I believe we are making a difference and we are saving lives. So thank you.
Thank you, Prosecutor Musella. My goodness, it is so true. And, the one word that goes through my mind as I think of all the people that are participating tonight, it's an inspiration. And, this is a devastating disease process. And as we know, it's just been terrible just to have so many lives dying, so many young people. And, we just sometimes feel like, so helpless, but this is the one way we can really make a difference, where we can come together I mean, of course, there's many ways we make a difference. I mean, just listening to the prosecutor talk about all the different programs that you have to offer, the recovery court, that sounds great. You know, I mean, it really does sound great. And, but the fact that I see so many people out there, I mean, all the people that work in resources and treatment, yes, they have been, you know, they just do it like clockwork. But the police, I just am so inspired by the officers that are on tonight, because they all are their integrity to helping their community is palpable. I have the pleasure of introducing Sergeant Szot, John Szot. Is he on? I think that he's here. Yes, he logged on. Unfortunately, I'm really sorry we had the wrong ID number for a while. So, you know, I was just a little unsure if everybody was able to log on correctly. But Sergeant John Szot of the Park Ridge Police Department. And I got to meet him a couple weeks ago. And we had an event at the Park Ridge High School. It was the very first time any high school had the Black Poster Project alongside the Alumni and Recovery members speaking and sharing about the pathway of addiction. And then they allowed the students to walk through all the posters. And, you know, Dee Gillen has created over 400 posters. And Sergeant Szot's there with the posters now. But what I was amazed with was the fact that you could just see that you have such care, Sergeant Szot, for your youth in your community and everybody else too, to just make sure that they understand that, you know, you're on their side and that you're there to help them along this pathway as they grow, just trying to, you know, understand and beware and be cautious and mindful. And I really appreciated listening to you and watching you just talk with the public. And so I'm going to turn it over to you now. Thank you very much.
All right, can everybody hear me?
Yep.
All right, good evening. Thank you for putting this together, Nancy, and Prosecutor Musella, thank you very much for speaking also, and to the rest of the speakers that are going to be speaking tonight. When I was speaking with Nancy, she was just asking, kind of go over what we do as a town in Park Ridge and how we try to connect with the kids and spread the awareness about opiate abuse and addiction. So a few years ago, I was, you know, on the internet, and I found a program called Niven Once. And it's a great program that Chief Lisa Parker came up with of the Manchester Police Department in New Jersey about 5-6 years ago or so. And I brought it to our command staff, and I said, you know what, this would be great for the kids. So myself and a few other officers went down to a training seminar and a course on how to become teachers of this program. And, you know, we brought it back to Park Ridge. We kind of made a few adjustments, made it our own. And we really, in my opinion, we really ran with it. And the great thing about it is that every instructor, it's me and 3 other officers, we have a personal connection to addiction and what it does to families. So whether it be a family member or from a close friend or acquaintance, all of us have direct correlation with someone who is in recovery. So the thing that's great about that is that, you know, just like anything else in the world, we're not voluntold to do this. We want to be there. We want to do this. So I think that just gives it a whole different level to begin with. So pretty much real quick part about what we do. So the first day we go and we speak with the kids, and we're in polo and BDU pants, and we kind of talk about ourselves. We share with them, you know, who we are, that we have families, we have kids, we like certain hobbies and so forth, to show that we're people just like they are. And the great thing about Park Ridge is that a lot of the officers in this town actually grew up in Park Ridge. So we can relate with them saying, hey, I sat in your seat where you were 15 years ago. And that kind of builds an instant rapport with the kids. On the second day, we go over drugs, opiates specifically, and different types of opiates, and what they could do with you, to you, what they look like, and so forth. The third and fourth day, we have live speakers come in, and they go over the first day might be a person or a few people in recovery, and that's how I got to meet Nancy with the AIR program, and it's been fantastic. And one of the great things about that is all the speakers grew up in this relative area. So it's not like a person from another state or South Jersey or whatever that the kids are like, oh, it doesn't happen here. It brings in the whole basis that, you know what, it does happen here. It happens everywhere, and it is a problem. The other thing is the fourth day we'll bring in a parent or a family member of someone who is in recovery. So it shows that it doesn't just affect the individual who is using or was using, but it affects the whole family dynamic. And believe it or not, we've heard stories that stuff even happening in Park Ridge that we didn't even know about, and it really took us by surprise. So it's really eye-opening that you think you know what's going on, and then you learn about things that you had no idea that was going on. So it's a real humbling experience. And then the last and fifth day, we go over signs and symptoms of an overdose. And that's where I kind of step in with being a drug recognition expert, because of all the training that we've been through. You know, we kind of really go into the signs and symptoms. So we tell the kids, we're like, listen, we're going to talk to you like adults. You know, we know you're going to go to college. We know you're going to experiment with things. You're going to see things in life, or if you're in the workforce and so forth. But the thing is, we want you just to go into every situation with open eyes. You know, maybe think twice before you try something new. Maybe call for help if you see that someone might be in distress. So when we go over with the signs and symptoms of an overdose, we harp on the Overdose Prevention Act. So we know that it's okay to call for help, that they're not going to get in trouble. And it takes away that whole, I guess, that being afraid of or certain consequences that might be coming if they do intervene and get help. We also go over naloxone and what we use that for. We show videos to the kids on how naloxone works. And we go over some stats in Bergen County and how much this has escalated throughout the years and how it is getting worse as time is going on. So this year, though, we were actually fortunate, I guess you would say, because we had the Black Poster Project that joined us during this week when we did the 911s program. And it really showed the kids that it's not a race thing, it's not a gender thing, it's not where you grew up thing, it's everywhere. And when we spoke to the kids the following day in class, they said that the people they saw on those posters, the ones who lost their lives to addiction, looked like them. And that's what really made them open up their eyes, that, you know, they went from that feeling, oh, it could never be me, never happen here, you know, not us, to more of like, it can be me, it can be us, and it is here. So, you know, we told them that if what we do saves one of them or saves one of their friends, and it makes them think twice before doing something, we really did our part. So the program's going strong. We've been doing it for a few years. We do it to the junior class every year. So we go in once every semester. We're there for a full week. And, you know, it's just a great community policing thing. As we all know, policing in general is changing on the way law enforcement operates. And, you know what, I think community policing is a great addition to what we've been doing, because it puts us on a more personal level. The kids know us, they're not afraid to come up to us, they're not afraid to you know, express their problems or concerns or anything along those lines. And you know what, if they you know a friend is struggling or having a problem with something, or a family member, they know that at least we have resources, that it's more that we can help them out and try to curtail the issue more than again you know, emphasize through the court system. So we're looking to help people more than you know, send them to the court system and go that route. So thank you very much for having me here. I'm not sure if Nancy, you have any questions or anything, but you know, I just think it's great. If any department or anything wants to look into the 911s program, please do. It's on the Manchester Police Department website. And as I said, you don't have to do it verbatim. Make it work for your department. It's you know, what we do best. We know our own community, and we know what works and what may not work. So, and if you guys have any questions, send me an email. It's jzot@parkridgepolice.com, and I'd be more than happy to guide you in whatever direction I can with what we're doing here in Park Ridge.
Thank you so much, Sergeant Szot. And I like that idea. You know, if everybody could just put their information in the chat, the officers that are on and Nikki as well, that might be helpful so everybody can continue to communicate and share ideas and thoughts. And I really appreciate you being on tonight. And so we're at the top of Bergen County, and now we're going to go all the way down to the southern half of Bergen County. And we have the pleasure of also having the Lyndhurst Police Department here, and Lieutenant Paul Haggerty, as well as Captain Carrino, Mike Carrino, who is also on there. See, I love that. I seen these two. I love how you two hang out together. By the way, first time I saw them, we were on this we had this special committee that we're both a part of, and sure enough, they were there just sitting together, and I really loved that. And then what was so interesting is that we have an event coming up. The event is going to be on the 15th, which is Tuesday, at St. Michael the Archangel Catholic Church in Lyndhurst. And we will show you that screen again later on. If everybody missed it, you could take a picture of it. We have flyers out on it, but the Black Poster Project will be there, and it'll be our very first Lyndhurst community event. So when we talked to Father Mark that day to plan the event, I immediately said, oh, we got to call the Lyndhurst Police Department. And unbelievable. You all were so easy to connect to, like that. I mean, you two signed up for this in like an hour and a half. In fact, Dee Gillen's on this call too. I was like, Dee, I can't believe it. We have a complete community event already, because you immediately got the comprehensive behavioral health team in, and the two of you were just right there, right on, and we're full throttle. Yes, we totally want to do this. We totally want to be involved in anything you have to offer for our community in the way of opiate addiction awareness. We are here to serve. And that is exactly what I heard from you two. So Lieutenant Paul Haggerty is a lifelong volunteer firefighter and former chief, and assigned to overseeing community police outreach. And again, like I said, he's committed. Captain Michael Carrino is right alongside him. So I don't know, I'm just going to say about him too. He's a volunteer coach in town and a member of the school board. And well, take it away, gentlemen. It's all yours. Thank you.
It's a little hard act to follow with the Prosecutor Musella. He set the groundwork for everything we do. And Sergeant Szot, I want to thank him for bringing up one of our points. We actually also run the Not Even Once curriculum through our high school. We as well do junior year in health class. We have a very proactive community policing element in our department with a sergeant that we have embedded in the school system as the SRO. Sergeant Passamano has an office in the high school as well as one in the middle school. And we have about 6 instructors that attended Not Even Once training in Manchester. I've been bringing that program in for at least 4 or 5 years prior to the pandemic. We'll be starting that up again this spring in our high school. It's a great program. Again, like, not to repeat what Sergeant Szot said, I'm not going to rehash it. I thank him for explaining it in great detail. It's a great program to bring the officers in and connect with the students and really explain to them the dangers associated with experimenting with drugs and narcotics at a young age and where it starts. Bergen County Prosecutor's Office and our agency have a close relationship. We've been working together on the initial onset of when we realized that you can't arrest your way out of the opioid epidemic, and there's other ways to attack this as law enforcement. So the Prosecutor's Office and Lyndhurst Police have a strong partnership with many initiatives that we started early on with the Operation Helping Hand, having our detectives assigned to their task force when they go out into the cities at which a lot of our residents frequent to purchase narcotics illegally. We also we're one of the first 2 departments to offer a diversion at the time of arrest for low-level offenses, to offer them a peer recovery specialist if they had low-level amounts of narcotics and/or committed shoplifting to augment that addiction they have. So they're great programs that we work with the Prosecutor's Office on. The third of which we're actually just, when you first met us, was this mental health working group and this pilot program that we're running. There's a lot. Prosecutor Musella was in our township last year. Yearly, Levy's Pharmacy partners with us. They're around the corner from police headquarters. They distribute free Narcan to those that want to come in, no questions asked. It's a great program. I'm a member of our municipal alliance, which we've been going pretty strong with the last few years. We have civilians and school teachers, coaches, officers all assigned to it, which kind of brings the community together to target this issue with opioid abuse and the epidemic that we're really facing right now. We also maintain a 24-hour drop box in our police headquarters under surveillance. Detective Regent manages that. So 24 hours a day, 7 days a week, no questions asked. You can come in and dispose of your unwanted medication or narcotics at our police headquarters in a secure facility, and it will be discarded properly. So it does not get in the hands of young children or anyone who should not be around that. Go ahead, notes here.
That's why we were so excited, Nancy, when you reached out to us with the Black Poster Project, because we're always willing and happy to try new things.
This year so far, we unfortunately already had 2 fatal overdoses. We've administered Narcan 3 times. In 2021, we had 17 Narcan saves, and in 2020 there were 23 Narcan saves. Fatal overdoses. We were at 3 fatals in 2021 and 2020. It stayed at 3, unfortunately. And we like to see that number go down to 0. That's the goal for all of us here. I think that's why we're all working together, law enforcement, the prosecutor's office, civilians, clinicians, and anyone else in recovery that is on the front lines here with us to battle this. So we thank everyone involved. We thank Alumni in Recovery for having us, Nancy, Morgan, Prosecutor Musella, Sergeant Szot, and all of our 3,000 fellow officers in the county that are combating the same mission here, to end the epidemic.
Okay. Can you hear me okay? I'm sorry, I think my internet connection was unstable, so I apologize in case I start going in and out, but I'm okay right now?
Yes.
Okay, great, thanks. Oh my, what I really think is extremely interesting is that you have started this initiative with Nikki. With comprehensive behavioral health for the mental health response. And I think that's something that's just right on the cutting edge of what's needed in every department to create these collaborations in such a way that you do have the backup and some expertise in the field. I have worked in psychiatry for many years. I was in behavioral health at Bergen Newbridge when it was Bergen Regional, Bergen Pines, and many other places in Utah too. And it's really important to have skilled people to be able to understand how to help you talk with people that are extremely agitated, and it's not an easy task. Especially when there's safety, safety first. It's always safety first, So it's so wonderful that you are able to have that backup. And I can't wait to hear from Nikki to hear what she has to say about the whole initiative that you're doing.
Yeah, it's been great so far. We've only had it a couple weeks, but our officers love it. I think the ladies from CBH care love it, and I think it's going to be a really good thing.
I do too. I have to say that I've had the pleasure of meeting a few of the women there, the director, Sue Devlin, and Michelle Laughlin, who's over there. I always want to say McLaughlin, but it's Laughlin over there. And Nikki has, I've met her a couple of times, as well as she had participated in one of our community events that we had for River Edge a while back. And but I gotta say, you all the women there are extremely compassionate and have a real care and a real personal touch to the care you deliver. And that's a special thing. So with that, I'm going to turn it over to Nikki. Thank you.
So I think our relationship with Lyndhurst goes far, far back. They were our beginning. That's where we started. And I think that we understand that the police are the front lines, and you are the ones who go in there, and sometimes not the greatest situations. And all over the country, this is happening where mental health and police are teaming up together. It's very overwhelming. And I think that we feel as if we're your partners, and we hope that you feel the same. Right now, it's starting really small. We hope that it will get bigger and bigger, and we can have someone there more and more. But for right now, we have someone at the Lyndhurst Police Department once a week for half a day. And we hope it'll get larger and larger. That person is there to take calls if needed, to go on calls if needed with the police, or to just answer questions, and to maybe educate and to receive education as well. We are looking forward to a really long, healthy relationship that we've always had with Lyndhurst. They've always been very welcoming, very opening. And like I said, that's where we started our humble beginnings. I do want to comment on what everyone said, and together, I am so happy as someone in mental health, as a resident of Bergen County, and as a mom, that everyone focused on children. I think that it's so important to start with kids. I think it's so important for our kids to see the police officers as their ally. I think it's wonderful that you're doing so much work in the school. I have to say that I'm in Lyndhurst High School pretty often. And the kids see Officer Steve, and everybody's so happy to see him, and everybody stops, everybody talks to him. And I'm sure it's like that in many other schools. And it's so important, because when those kids get older, they're gonna look at the police like an ally. And I think I know that's something that all of you want. And I think it's wonderful that's happening, and it's a reality. Something that's also happening in Lyndhurst, which is happening in a lot of the other schools as well, is they're doing teen mental health first aid. And we're bringing mental health to the kids. It's 6 modules, and one of those modules is drug abuse. We don't go into it that much. We just kind of touch on the surface. I'm very happy to hear that there are other programs in one of the towns that I lived in. I know we've had a lot of talk about it, and I know that it's heavy substance abuse when children are younger, and then it kind of can taper off a little bit. So I'm really happy to hear that it's in the high schools as well. Here at CBH Care, we're a community mental health agency. We have our wellness center in Westwood. It's our county's urgent care center. It's a walk-in during the day. You can call and speak to someone at all hours. And it's a very welcoming, open environment. That's for 18 and older. We also have outpatient services, as well as many other services that I'm sure people are aware of. Mental health is such an important component of this. Not only do we know that people get involved with substances for all different reasons, but a lot of times when you're in it, it eats away at who you are and your self-esteem. And mental health is still such an important part of that. And we hope that we will be partnering with more departments, more officers, not just us, but other mental health agencies. And this will become the new norm going forward. I'm going to wear a different hat for a moment. And I know I do this every time, but I think it's so important. My children, their school had Alumni in Recovery a few years ago. And this is back to what Sergeant Szot said, actually. And at the time, my boys were in 8th and 9th grade, I believe. And I thought it was very important. And I had seen it before at another school. And I dragged them kicking and screaming, and they didn't want to go, and they learn this stuff. They know it all, just like kids do. And they saw themselves. They saw young people who were just like them, who were from the same places as them. And when it was done and people started asking questions, I texted them. Obviously, they were sitting across the room. And I said, okay, we can go now. And both of them said, we're not going, we're staying. And on the way home, it started amazing conversation, because a lot of times we don't talk about things that are uncomfortable. And I'd like to say what an amazing organization it is, and kudos to Nancy, and kudos to all those young people who are bringing their message and talking to our children and letting them know that they are them. It's so very important. And I hope going forward, we all continue to work together. I put my cell number in the chat. If anyone has questions, if you'd like to contact me, please feel free. If you're stuck and you have any questions, however it is that we can work with you for our community, we are all in. And again, I can't stress enough, I'll see everybody on Tuesday in Lyndhurst. And we're really happy to have the relationship that we do. And I know it will continue. Thank you.
Thank you, Nikki. And thanks for that personal touch about your sons. And I think I remember which event that was, actually, because I think it was the very, very, very first parent program we ever did in River Edge. And it was a really well-attended event. Yes. And it made me so excited. I'm just going to tell everybody this really quick. It made me so excited because I was like, wow, we have to start doing parent programs, and we have to start bringing in their peers, people that, you know, so that's when we created the parent program. And that's when the parents that have lost their children to addiction became our parent members to talk from their standpoint and their children's, and hence how I got to meet Dee Gillen. But here's the interesting thing. We found that, you know, and I think everybody knows it's very hard to get people to attend evening events. And what is so special about these community type events where we have the police, we have someone like you, Nikki, we have the prosecutor, we have locals that, like, you know, provide food, you know, that, you know, because we're not going to serve booze. It's a community event that, you know, we have to attract people. Let's attract them so we can involve people. We can get people involved and give them tasks. And that's how the community events and community action within Alumni in Recovery really took off. Because, you know, to just have the parent events, it's good, but they're part of a community, and the community has to hold them. We have to hold each other. And I'm so inspired by these talks that we're having. And I'm really, really excited, since there's 3,000 police officers in Bergen County, that Prosecutor Musella will get to be here until he's probably 95 to have, you know, talks with all of them. And but it's so important. And you have no idea how important your stories matter. And that's how we're the language of the heart of us speaking to each other and just being able to see each other, and is going to make a difference. So with that, I'm just going to say a couple of things about the events coming up. And I do have Dee Gillen on, and she's welcome to jump in anytime, because she is the creator of the Black Poster Project. And the Black Poster Project has a lot of love and care goes into each and every poster. Dee, would you like to say something about the upcoming event coming up?
Sure. Hi, everybody. I think this is a great event that Nancy does, honoring all you police officers and everybody in this field. It's so important. And I always feel that, I think I said this Sunday, you know, people like us that have gone through the addiction process and then lost our battle, we don't know where to turn to now. We still want to help. And we have a place now with all of you. you've embraced us, and together, you know, we form a big circle of support for so many people that need our help in all these different ways. As the peers going through the speakers like Morgan and the recovery people that go into schools, the bereaved parents, the police, the prosecutor, all the resources. I mean, it's just so much, everything is so important, every element. And I'm very grateful and very thankful and very humbled to be working with all of you. But that being said, so we have our event next week, and we're really looking forward to bringing it to Lyndhurst and meeting all of you. And then I think we have Bergen Community on March 31st, and then Nancy's Big Walk on the 24th.
Oh, yes, it's
So-
Nancy's big walk.
Nancy's Big Walk.
Everybody's big walk.
Yep. But thank you again, everybody, for being part of this.
Thank you, Dee. My goodness, again, she works tirelessly at creating these posters and getting them to, we're gonna, you know, we can bring them to schools. Like again, thank you to Andy Yeager from Park Ridge High School, the SAC there, who brought us in and created the very first full Black poster project in the schools with a community event in the evening. Beautiful. I mean, this, you know, so we're going to continue to be able to do that. And, you know, there's a lot of work that goes into it. And there's a lot of volunteerism that goes into it. You know, there's a lot of people that volunteer their time to help with this, and it makes a difference. But just again, a walk to remember, which will be in Westwood, New Jersey at Westvale Park. It's like a 0.6 mile loop around some fields. It's a great space to have a walk. And Prosecutor Musella was at our first one and spoke, and he's coming back to speak again. And he's going to do a special tribute to first responders. And Dee Gillen is creating, not only is she going to have all the Black Poster Project in view there, which you can kind of see on this picture, but there will also be so many displays that are just going to be breathtaking and encouraging and fun and touching. And some we can even like interact with. But she's going to create one called Heroes Way. And we'll have a pizza positivity program piece there too, which is where the law enforcement are able to give out pizza to, and I think the Westwood Police Department has volunteered to do that. But Pizza Positivity is a program that we do with Bergen Newbridge. Thank you, Recovery Center and Mike Polello, who are also on this call. And the Pizza Positivity program is so police and students in high schools can work together at bringing some positive, yummy pizza to patients in Bergen Newbridge. There's over 80 beds at Bergen Newbridge. It might be 100, and also for addiction services. But what's so cool is that the students write inspiring messages to the patients in Bergen Newbridge. I mean, you can't beat that. And I know that Matt Stanislaus, I'm sorry, Matt, I'm killing your name. Matt Stanislaus, I think I said it right, from Glen Rock is on this call. And he actually did a Pizza Positivity at one time. But so it's just, it'll be a great event. So many people can come together, you know, and all the resources can have their tables there. And we have an ability to you know, really put some light on this stigmatized disease process. And we need to do that together. And I'm glad that we are working together to do that. Prosecutor Musella, do you have anything that you'd like to say before we end tonight?
I just want to thank you, Nancy, for putting this together. And I want to thank the police officers for their service every day. Thank you, guys and ladies. And all our partners, thank you. And I said that I will be there Tuesday night, and I will be at the Walk to Remember. I'm going to be in Florida for the March event, but I will be at the Tuesday, and I'll be in Westwood. So thank you.
Fantastic. And I want to take a big shout out to Morgan Kennedy for doing these wonderful video productions. She's also records that they're recorded. They're going to be on YouTube later if anybody wants to share them with anybody at all. I think they're very educational and they're great for anybody in school systems or anything. So so thank you again to all of our police and Nikki for being on tonight, and look forward to working with you
Thank
all
you.
in the future.
Thank you.
Thank you. Thank you.
Okay.
Thanks, everybody.
Have a good night.
Okay. Good night.
Good night.
Good night.